Hello friends. So in today's episode we are going to discuss about a very common problem, and that is low back pain. And in the last say 1 or 2 decades it has become like an epidemic. Almost on daily basis I see several patients who have back pain, and when I was a student, when I was training in neurology, we were told that this is a problem mainly found in the older age of above 50 years. But today, unfortunately, I see many patients who are suffering from back pain who are much younger, even in their teenagers, or even in 20s and 30s. So today we'll look at all the common causes, what are the symptoms, how we diagnose, how we treat, and the most important, how do we prevent them. So if you look at common symptoms of this back pain, of course the most common symptom is back pain, which can be in the lower back, either in the center or on the sides. And if the symptoms are more severe, then the pain starts radiating from the lower back to the buttocks, thighs, calves, and up to the foot. And along with the pain, there can be something called as tingling or pins and needle sensation or numbness, and sometimes the weakness of foot or the leg muscles. And many times they can be, if the symptoms are very, very severe, then urine nerves and the bladder and bowel functions can get affected. But that is fortunately its uncommon symptom. The symptoms tend to get worse when the person starts moving or bends down or sometimes sneezes, but it can be present at rest also, and many people the sleep gets affected because of the pain. Now, what are the common causes for this kind of back pain? So if you look at our spine, this is the backbone, and right from the neck, then the thoracic region, and this is called the lumbar region or the lower back. As you can see, there are vertebral bodies or the bones, and between the bones this grayish tissue is called the disc. The purpose of the disc is to stabilize the spine and also allow free movements of the backbone, either front, back, or on the sides. But many times, because of the wear and tear, the disc can degenerate, and then from these gaps between the bones the nerves come out, one on each side, at levels of the neck, thorax, and the lower back. And when the disc degenerates, it can slip out and put pressure on this nerve, and as a result the pain, which can be found locally and also along the distribution of the nerve, when the nerve goes down, the pain can radiate. So that is the symptoms, that is the root cause of the symptoms. It's also called root pain. Now, many times it may not be so severe that the disc has come out and the nerves are compressed. It can be just related to the posture, and nowadays unfortunately most people have to sit for a long time, whether it is part of the job or students who have to sit and study. And many times just to watch TV or browse internet, people need to sit for a long time, and prolonged sitting, I think, is the commonest risk factor for this kind of problem. Second could be a bad posture. So if somebody has to keep on bending, to work on the laptop or the computer. And third could be lack of exercise, because nowadays most people have become sedentary, and if the exercise is not done, the back muscles become weak, and as a result they are prone to back pain and also the slip disc. And the next risk factor can be overweight or obesity, because entire body weight has to be sustained on the lower back, and if somebody is overweight or obese, then obviously the pressure on the lower back or the lumbar region will be more, and they will be more prone to get slip disc and the back pain problems. Other risk factors have been identified, like deficiencies of vitamin D, calcium. If somebody has a positive family history, they are more prone to get it. Sometimes trauma or accidents in gyms or while playing any sports or any other motor vehicle accidents. So these things also can give rise to back pains. Now, when a patient comes to us, what do? So one is we try to ask these symptoms in the history, and that often gives us a clue what could the possible cause be. And then during examination we have to make sure that there is no area of the leg or the foot which has become numb or which has become weak, because that could mean that the disease is severe and more urgent attention is required. If there are no motor or sensory deficits, means there is no numbness or weakness and it is only pain, then most often medical treatment will suffice. And then the only single test which we need to do to confirm this exact severity and the root cause is something called as MRI, which is like a scan which looks at the lower back, and the bones, the disc, the nerves, all of those structures can be clearly seen in that. and diagnosis can be established. Sometimes people, there are other conditions which can cause back pain. One of the common things in younger people we should look for is what is called as sacroiliitis. So that is the bone which joins the sacrum and the iliac bone in the lower back, and there is a condition called as ankylosing spondylitis where people can have inflammation in the sacroiliac joints in the lower back. So there people only have low back pain, and the pain is severe on getting up in the morning and on the movements, but the pain doesn't radiate to the buttocks, thighs or the legs in that condition, and that also can be diagnosed with the help of MRI and few blood tests. So it's easy to diagnose. The next condition to remember is something called as piriformis syndrome, where the nerve gets compressed under the piriformis muscle. So in that there is no back pain. Pain starts in the lower part of buttocks or the gluteal region and goes to the thigh, and it can go to the legs also. So that is another one more important cause which can mimic the slip disc syndrome. So once we have established the diagnosis, then the next is to start treatment. So treatment aim is to relieve the pain. So for that we have various medications which can be used, prescribed by a neurologist to relieve the pain. Second is part of the physiotherapy where they have techniques to relieve the pain. And the second is also they will teach various exercises to strengthen the back muscles, which are important to relieve the pain as well as to prevent further progression of symptoms. And then finally, if patients don't respond to these two conservative or the medical treatments, then some people may require what is called as epidural injections of steroids or anesthetic agents to relieve the pain. And finally, in say less than 10% people, when everything fails, pain is very severe, or somebody has already got areas of numbness or weakness or bladder involvement, in such cases surgery may be required. So these are the various modes of treatment. Now the most important thing is how does one prevent this, because as we know prevention is better than cure. So number one is that avoid prolonged sitting. So if someone has to sit for several hours for the job or other activities, every 30 to 45 minutes get up, move around for 1 or 2 minutes and come back. And then if you are going to the gym, do it properly under guidance, because lifting heavy weights in wrong postures, wrong techniques can predispose to slip disc. But normal back strengthening exercise should be done by everybody, so it's easy to do. You can watch YouTube videos, or you can also learn from some trainer and then do it at home. So that is one way to prevent slip disc. If someone is overweight or obese, definitely they should work towards reducing the weight, because normal weight will definitely reduce the chances of slip disc. And so I think these are the various things one can do to prevent the slip disc and the lower back pain. So the most important thing is to try and prevent the slip disc and the low back pain. But if you are suffering, no need to worry. You can consult a doctor, and proper evaluation can find the root cause, and correct treatment can make you feel much better. So I hope you have learned something useful from today's session, and please like this video, share this video, and also post your comments and queries, and subscribe to this channel to watch more educative videos in the future. Thank you.